No, she's very nervous.
Yes.
Food motivated, but nervous.
Can we treat? I know. Because last time we sedated you here and then we cleaned your ears so much, and then that probably wasn't very fun. I know. It's okay. Okay, so it sounds like the ears cleared up for a bit and then not so much anymore. Sometimes, especially in the summer when they're sweating and swimming, there can be a scent there, but doesn't always mean there's an infection. So we don't always base our kind of interpretation on scent. But if they're sore, they're red, she's shaking her head a lot, then we are more concerned with their
paw licking.
Paw licking. So yes, that was the other thing that I think you saw Dr. Westcott last time. Did he talk to you about allergies? Did he mention allergies?
He did mention allergies, but he said we'd talk about it at the follow-up.
Right. So that's my job now. Do you find that, I know she's had ear infections in the past, do you find that they happen kind of once a year, or is she all around? Continuous.
Yeah.
Okay. So our two categories for allergies are usually food intolerance allergies or more of an environmental allergy.
Right.
Food allergies are kind of nice because once you figure out the right protein for them, then you can get them on a hypoallergenic diet and then the allergies resolve. Environmental allergies, you can't really control that a whole lot because it's in the environment, they're going to go outside, they can't live in a bubble. So
I think it's the issue for both of them.
you think environmental you're leaning towards?
I think it's the food.
Food, okay. So it is a long haul sometimes figuring out what protein works for them.
Right.
We recommend initially is a hypoallergenic diet. So I don't know if they have it at the pet store. We have it in stock, like a veterinary prescription diet. It's fully nutritionally balanced, but what they do is they break down all the proteins so they can't be allergenic. So there's 0 proteins in there that can be allergenic.
Okay.
Try them on that food for 6 weeks minimum.
Okay.
And then see if things resolve. There's reduced paw licking, reduced incidence of ear infections, then it's likely that
That's
is
my
the
gut
problem.
feeling about it.
Okay, so yeah, trust your gut feeling.
Yeah.
That's what I would recommend. Trying
Okay.
both, and you have to limit all treats. They can only get the hypoallergenic diet. I think they make hypoallergenic treats as well, so you
Okay.
can have those too. But
Sure.
ideally, yes, only eating that, no table scraps. Try that for 6 weeks minimum. If you find that helps, they can stay on that diet long term. It's perfectly healthy for them,
Yeah.
but it's on the pricier side. So
Okay.
what people sometimes do after that is slowly introduce new novel proteins to them. So you'll get a single protein diet, sometimes like a kangaroo or a...
That's what I have them on, was the kangaroo
Oh,
food.
really? Okay.
Yeah.
Yeah.
And a nice one.
It still can be allergenic, so it'd be, trying a fish maybe next time, or
Yeah.
some sort of novel protein to them, not a chicken or beef, like
Okay.
is the most common allergies we see. But you can try reintroducing them, or you can keep them on hypoallergenic food.
Okay.
But that's what I would recommend, trying for long-term maintenance to reduce the recurrence. But if there's infection in there right now, we need to treat it. Resolving the allergies isn't gonna treat the ear infection, unfortunately. So
Sounds good.
yes, and you have to let me look in your ears though. What do you think?
You gonna let her have a look?
Yeah, good girl. Hey, so is this what you're talking about here?
Yeah, like, see, feel right
It looks
here.
quite healthy to me.
Feel
So-
right there.
That's just the cartilage of the ear.
Is that?
Yeah, and when it's folded back, it feels extra hard because there's kind of 2 layers there.
Oh,
I
okay.
think that's what you're
I'm just
feeling.
being paranoid, probably.
No, I mean, it's
Don't
good to
want her
monitor.
ears to hurt her.
Oh, exactly. And the other thing to look out for when they good girl doing a lot of shaking and stuff is that they can get a blood blister.
Mhm.
But typically that looks like kind of this part of the ear puffs up like this.
Oh, interesting.
Yeah, and they're not
seen
great.
that.
So
I don't.
hopefully, but her ears look quite good right now. I mean, thank you. There's no redness in there, and I will take a closer look at them. But I think ideally we don't need to treat her with more antibiotics. Ideally, we maybe start with the cleaning and see where that gets her in terms of irritation. I know that her infection was mostly yeast-based last time, so this is probably what I would recommend, this yellow cleaner,
Yeah.
malicylic acid, and you can just honestly squirt that in her ear and let her shake it out if she's
Okay.
really bad for cleaning. If you're able to get in there with a nice damp cloth or a little bit of gauze and just wipe it out,
That's
but
what I do.
I'm not seeing a lot of debris in there right now anyways,
No,
so
good.
kind of cleaning it up. This helps all the wax break up, and then it
Yeah.
also dries itself out. So after she's done some swimming and stuff, if there's water in there, this will help dry those
Oh,
ears
good.
out.
Good to know.
Yeah.
Okay.
Mhm.
I didn't know it did that.
She looks great to me. She didn't really have a fever. I know. Good girl. Hey. Good girl. I know. Those ears look good. Like very minimal debris. And then if she's having some, I mean, that's kind of the basis for the allergies, is the allergens get under the skin and cause itchiness. And then eventually, once that irritation like kind of spirals and snowballs, then
Yeah.
we end up with an infection. So right now we're probably at the stage where she's maybe experiencing some allergy symptoms, so they're itchy,
Yeah.
so she's shaking, but not an infection present that I can tell.
The thing that took me off with it was watching how much Gigi was gnawing on her front feet.
Yeah, that's a big sign of allergies in these guys, so. Wait, look at those teeth, beautiful. Did she do a lot of chewing?
Mhm.
Did she let you chew? Yeah, her canines are, hey,
Yeah,
she's got some wear on those canines.
She ate a whole chicken right off the counter.
Chicken's not good for
dinner.
you, especially if you have allergies.
fast.
Yeah, there's some dryness in there, a bit of waxy buildup, but
Yeah.
nothing I'm super concerned about. I don't feel too hot.
No.
Yeah, I would start with the cleaning. Let us know if you notice more buildup, discharge,
Okay.
redness. Then I'd be concerned of infection setting in. But if we can get ahead of it with the cleaning,
Mhm.
that would be ideal for her because I don't want to keep pumping antibiotics into there. Oh, what they're doing to me is awful. Okay, sweetie pie. Almost done. That looks good. Good. No limping or anything like that?
No.
Good. Yeah, she feels great. And her coat's good, so
Great.
I'm glad that she doesn't have any itchiness all over, but sometimes the allergies kind of present themselves as just the ears and the paws. So try the hypoallergenic diet, see how that gets you.
Okay.
And we want to update vaccines as well. Is that correct?
Please. What? She's like, I'm down.
You want some. You want to get a little bit. And show your sister that it's good.
Oh, Cappuccino.
She's like, I'm sorry, bring this back. What do you think? Oh, yummy.
Okay, she is nervous because she would eat that in a heartbeat.
What do you think? That smells really good. No? You're like, it smells so good, you're salivating, but you don't want to.
Good girl.
Oh, spray. Once a year deworming for most dogs is adequate.
So when they take it, is it time release, the dewormer?
I mean, they digest in their stomach and then it releases from there. So,
So it kills anything that's there, plus any eggs or...
yes, as it goes down the tract, it continues to
Right.
work.
And so after that goes through the system,
Mhm.
is that it? Or does it continue working?
No, that's it. It
Oh,
kind
okay.
of clears the system out, gets rid of any parasites, and then and then you need to do it again if they were continually exposed to parasites. But
Yeah.
unless they're eating mice is
You know
the
what they
biggest
are
thing.
doing though? Is I have some old lumber on the property with some tarps on it, and there was some water in it, and they
Oh,
were
yeah.
drinking. I saw them.
Yeah, that won't be parasites so much. More so like lepto
Right.
would be the concern for that. So she's up to date on her lepto now. So
Great.
shouldn't have to worry about that. Parasites, yeah, mostly if they're eating mice is like the biggest risk factor for parasites. So as long as they're not doing too much of that, once a year deworming is adequate.